Well, the first thing I would like you to introduce yourself and talk a little about your project.
Okay. Thank you so much for the kind words. My name is Macarius Donneyong. I am an associate professor in the colleges of pharmacy and public health at the Ohio State University. I was trained as an epidemiologist, and I study the safety and effectiveness of prescribed medication use from real-world settings. In particular, I apply AI and machine learning to discover drug combinations that we can optimize to reduce the risk of adverse drug events. Yes. So that's basically what I do for research. And what's the question?
The first question is, what are the main challenges and opportunities in applying artificial intelligence and machine learning techniques to evaluate drug safety and effectiveness, particularly among underrepresented patients group?
Oh, that's an important area, and it's a challenging question. When it comes to AI for drug safety and effectiveness, especially for underrepresented population, the data source for training the AI and machine learning models is the most critical, yet most of the data sources that we use for pharmacoepidemiology may not always have a good representation of minority populations. And the consequence of that is if you train AI or machine learning models in a data set that does not have a good representation of minority populations, they may create problems for minority populations when used later among them. So for instance, if you train a model that doesn't have a lot of representation of minority populations, it would not understand the main features that are driving the outcomes, be it safety or effectiveness among minority populations. And so when you transfer the model to minority patient populations, number one, it may not be accurate, and number two, it may even harm the patient population because it will give wrong recommendations. So that's my main concern about AI and machine learning among minority populations. The other aspect is actually in the development of these AI models. What tends to happen is if you want to develop an AI or machine learning model that is representative of the user population, you need to involve them as stakeholders in the development of these machine learning models or AI models. However, just like in many areas of society, minority patients are not included. Their voices are not included in the development of these AI and machine learning models. And we have to be concerned about that. And so again, my recommendation would be to make sure that the voices of minority populations are included in the development and training and implementation and monitoring of these AI models to make sure that it's working as it was intended in all patient populations. Thank you.
Amazing. Well, the second question I have to you is, how can advanced data analytics and pharmacoepidemiology study inform the development of more equitable and evidence-based health policies?
So this is a related question to the last point I made about AI. If you're going to be using advanced data analytics, which could be AI or machine learning, to make policies that have implications among minority populations, you have to get them involved. Without their input, you will not succeed in making policies that they will accept. Because think about policy formulation and implementation. It's a two-way direction. Policies should not be developed by somebody sitting at the top and bringing it down to the people at the bottom. You need to bring everybody to the same table, make decisions that you all agree on so that you are equal partners before you develop those policies. So bring in underrepresented patient populations into the decision-making process, and especially in the development of these AI and machine learning models. The other aspect when it comes to application of data analytics or AI for policy making, you have to test and make sure that the models have a property called fairness that is accurate in all patient groups that you intend to use it for. If it's accurate in the overall population, retest it. Is it accurate among minority patient populations? Those are fundamental, and they have this criterion has to be met before you can apply it for policy making.
Thank you very much for the interview. You're just amazing. Thanks for being here.
Thank you so much. Thanks for your kind words.